Diabetic classification. Although diabetes has very many classifications, it roughly divides 4 types. It is type 1 diabetes at first. Many children and youth are said to be type 1 diabetes, and the development of symptoms is very rapid, and insulin is indispensable to medical treatment. When medical treatment is overdue, consciousness may be lost, or it may die depending on the case. When you code type 1 diabetes for the first time, it is desirable to certainly go to a medical specialist or hospital immediately and to treat. And if insulin injection starts, please keep in mind not to stop insulin for judgment of one. If interrupted, it will return to a hyperglycemia again. Therefore, it is the principle of medical treatment that type 1 diabetes strikes insulin throughout life. Next, type 2 diabetes. I think that 90% or more of the diabetic of present Japan are type 2 diabetes. There is a fundamental hereditary background. For example, parents, brothers, and a near relation has diabetes comparatively, and if there are an environment factor, what is called overweight, lack of exercise, stress, alcohol, aging, etc. In addition, the symptom of diabetes will develop in high rate. Although diabetes develops in 40s and his 50s in male, and in 50s and 60s in female, it happens even if younger. You may think that diabetes develops in the very wide age group, which also shows the symptoms of advanced age. There are some patients who can control by a meal and movement fundamentally, and the medical treatment requires those who take the medicine which lowers blood sugar, and an oral medicine, and also those to whom control stops also attaching an oral medicine, and strikes injection of an insulin, etc. Since the medical treatment is various, I also consider that it is necessity to often consult with a doctor and also to make an effort in respect of a life by oneself that blood sugar should fully be controlled. Next, Gestational Diabetes Mellitus, GDM. It is said that GDM are easy to develop in those who is overweight, gives birth at advanced age, has family history of type 2 diabetes, and pointed out hyperglycemia at the past pregnancy. There are some patients who show the symptoms of type 1 diabetes at this time. Even if nothing is said until now, suddenly the balance of various hormones may collapse in the situation of pregnancy, and it may show the symptom of diabetes. Recently, such GDM has been increasing. Therefore, I would like you to put the correction of a meal and overweight in order by yourself. Since the child who will be born if control is bad in early stages of pregnancy is also told that there is very much influence. Controlling exactly from the first stage is very important. And since it is a principle in that case of GDM to use not medicine but insulin, when control is bad by the meal and an exercise cure. You also understand this point well, and I wish to think. Please consult with a special doctor. Next, diabetes by other causes. This also has very many kinds. The gene related to various diabetes these days is discovered, and the illness whose symptoms are shown by the gene abnormality is distinguished as diabetes by other causes. I think that many causative genes are known if a gene analysis will progress from now on. In addition, it is called secondary diabetes, and the patient who growth hormone and adrenal cortex hormone and thyroid hormone are secreted superfluously. In the person with burned pancreas, pancreatitis, and pancreatic cancer, the illness of internal secretion. Furthermore, liver disease, hepatitis, liver cirrhosis, and fatty liver are called diabetic cause. Since there are some other illness which is developing diabetes, please consult with a doctor well.